Okay, this is actually not my presentation. It's the presentation of Luciano, who is my vet manager, who is right now away for a serious business with surf and waves, so he couldn't be here, unfortunately. At the beginning, I had problem with this presentation because I didn't understand exactly what I was supposed to say. Then I realized that I'm here to talk about our experience with the CT scanner we bought. We are not a large clinic. We're not a general practice. We are a small clinic, and we are located in Genova. So we had lots of problems. I'll show you. Okay, I started my idea of buying a CT scanner because I applied for the GP cert of surgical oncology, almost done. And I realized that you cannot do surgical oncology, oncological surgery, whatever, without a CT scanner. It's not a good idea because you want to provide the best quality of medicine, because there are legal implications, and our clinic was not big enough, so we were obliged to send our CT scan to other clinics, to corporate clinics. And this was a problem for Luciano, who is our practice manager, who wanted to make his vets happy and wanted to increase the offer of the clinic without incurring in legal implication, wanted to keep clients, and wanted money. Yeah, exactly. Well, I'm stuck here. So I don't know if any of you guys know about the project management stages. They are 5 stages, just like grief stages. And the first, we completed the first 3 ones. So the first one was the initiation, and then the planning and the execution. The initiation is this. April 2023, there was a telephone call between Claudio and Luciano. Claudio called to pitch his company and to present himself, and told us that they built and sold a CT scanner. And Luciano answered, okay, good, but we don't have room. And he said, you know what? Our Vimago can fit in a room that is 10 square meters. So Luciano was suddenly interested. And we realized that we could put a CT scan inside our radiology that is only 13 square meters. Then I asked, okay, but do we need a real CT scan? I mean, a huge one, a big machine, or we can do with the Vimago? We went, we saw the equipment, we talked to the guys, and we realized after counting that these are right now all our patients. We have right now the same amount of cats and the same amount of dogs. So I was really worried about the dimension of the scanner, because I thought that the dogs would not fit inside the scanner. But we realized that we were going to be able to scan at least 75% of our patients, because I don't know about you, but we don't have so many large dogs. So even if 50% of our canine patients are more than 40 kilos, we still have 75% of patients that we can scan. And I know that this is a problem for a lot of people who want to buy a CT scanner. So we decided that we could do it. And we started with the planning. The planning was a mess. Our contractor decided to disappear at the beginning of summer, and summer in Italy is the hell, because you don't find anyone. So we had to work, we actually, all of us worked, to cover the walls and the roof of our 13 square meter room with plasterboard and lead. And in the end, we were able to get our scanner. It took from April 2023 to September 2024 to start.
Did you have to put the lab also on the ceiling?
Exactly. Yeah, because our clinic is in a building, so there is people living.
Yeah, but it doesn't go through the.
Okay, but there are legal implications, so we didn't want to risk anything. After that, no problem. Because I have to tell you, they followed us in every step, absolutely in every step. We spent a weekend working on the machine, learning how to use it. And then there was the difficult part, the really difficult part. He is Maurizio Longo. He is a radiologist, actually is his partner. It took me a month to convince him to read our scans. He didn't want at the beginning. He was not so sure about the scanner. So at the beginning, he told me not to buy it, to find another way. And then right now, he's really happy with our studies, really happy. He calls me to tell me how happy he is. Okay. We talked about how small is the room where we put our scanner. It's actually, we use it half of the time as an ultrasound room, and the other half as a CT room. Oh, I'm sorry. Non mi parte il video.
C'è Luciano in collegamento.
Non avevo dubbi.
Perché forse non sono. Non parte.
Okay.
Richiede accesso perché.
Okay, doesn't matter. I'll show you the video later. In this video, I can show you later. In 1.10, in 1 minute and 10 seconds, we are able to change the room from an ultrasound room to a CT scan room. So it doesn't matter if there is an emergency, it doesn't matter if the study is planned, we can change the room in 1 minute and 10 seconds. And we are able to start our study in 1 minute and 10 seconds. What else? Okay. So we did the planning, and now we arrived to the execution. And what have we learned so far? We've learned that it can take more than 1 year from the first call between Claudio and Luciano to the first study. It took us not more than 1 month to be independent from the Imaginalis guys, so from Ilaria, to start doing our studies on our own. we are not reading them. We send them to read to a certified radiologist, but we're able to perform and to have really good studies. It takes us less than 3 minutes to set up the equipment for a CT scan. It takes us less than 2 days to get a report. In 7 months, we've done 60 studies because we're not pushing it. We're just keeping calm and trying to do our best. The largest dog we scanned is Mia. She's 40 kilos. We did our first lympho TC, and they were pretty good. You can see the lymph nodes there. That's okay. Here. And this was just great for the surgery. Next week, we're gonna do this. This is the liver of a cat. And our next goal will be fluoroscopy and TC together, because we work with a very good endoscopic surgeon for brachycephalic syndrome, and we want to do a pack of fluoroscopy and TC before the surgery for brachycephalic guy. Thank you so much.